Good morning, everyone. I would like to spend a few minutes and talk to you about this important topic that comes basically I encounter every day, multiple times in the course of a day, and that is what are the different options for someone with jowling. And as a dermatologic cosmetic surgeon, it is the holy grail is what do you do with that heavy jowling? And obviously the traditional procedure has always been the facelift, and there are different types of facelifts that can actually vertically restore that jawline. And facelift certainly is an option. Some of the issues with facelift is that there's recovery, there's downtime, expense, and not everybody wants to go through a facelift. And facelift is necessarily not for everyone either. I think, in my opinion, facelift is someone who's older. I think there's so many other great options that can really push away the need for a facelift early on. And I think in my experience, 25 years of practice, I really think someone who needs a facelift is generally somebody who's maybe 65 and older. And I know you may hear different opinions from different specialties, and I respect all of them. But to me, there are certainly great options. And I think in my practice, the most important option is fillers. I love the filler called Juvederm Voluma. It's got a high G prime, it's viscous. It really allows me to really lift the jawline and create much better improvement. So fillers really are my first choice to go to. And there's really, I have a paradigm in terms of how to approach fillers. And that is really, we basically inject fillers into the cheekbones where the ligaments have been stretched, and by basically adding some volume in that location, we see dramatic improvement in really improving those jowls. At the same time, by injecting here, we improve laugh lines, we improve marionette lines, and there's really a technique that I have using cannulas that allows me to really dramatically improve that jawline. With fillers, really, we can see improvement that lasts for about up to 2 years. I've seen it multiple times in my patients who've been with me. And the pictures that we take before and afters really show that, where the improvements still last even 2 years later. Patients do not look like the way they did 2 years ago. So fillers are my go-to. A lot of times patients come in asking for fillers on their laugh lines, marionette lines, and it's about really educating them to say that by injecting in your cheekbones out here, properly using cannulas, we can actually improve all of this here. So it's about really reversing that triangle where basically with aging, we have basically the apex of the triangle and the heaviness here, but it's about really turning it. After fillers, I certainly have used what I call FaceTite. FaceTite is a radio frequency device that's inserted below the jawline, and basically the heat that's generated underneath not only leads to dissolving some fat, but it also causes some tissue tightening. So I've used it for the face, I've used it for the neck, I've actually even used it for the lower lids to improve bags, and that is a non-surgical treatment, and you see results over a couple of months. The nice thing about it is you don't need to do any surgery, so I have some good experience with that. So FaceTite is an incredible option. It's a device that's made by InMode, and again, inserting a cannula that's about this long, it's about 10 centimeters, and can really heat up what we call the fibroseptal network. And by tightening that fibroseptal network, we can actually really improve the jawline. Lastly, I've also used thread lifts. Thread lifts have to be used in the right candidate. You can't use it on someone who's really got a lot of heaviness, but for someone who's thin with proper threads, these are made of polylactic acid. I'm not talking about these threads that just basically dissolve that are thin. It's about really using these suspension sutures. With thread lifts, I usually get a year out of them. They don't really last beyond a year, and I can really use them for the neck and the jawline. So that is really, in a quick way, summarizing the available options. Really, I love fillers. I have nothing against facelifts. I think they're great, and I think it's just a matter of really choosing the patients properly. Have a wonderful day.